whatever you find, Red Cross around providing service to assist possibly the victims. And in this case, of course, that much they have also been doing. But in Ogun State here, we don't have coronavirus. We won't pray for that. We won't even pray for any other one that is even much lesser. And this morning, we are looking at coronavirus symptoms, signs, and prevention. And to discuss that with us, we have the state chairman of Nigeria Red Cross Society, Ogun State chapter, Prince Joseph Keke Obalanlege. It's nice having you join us on the program this morning.
Thank you, sir.
And we also have the National Training Coordinator, Nigerian Red Cross Society, from Yinka Fashion, also in the house. Good morning.
How are you? Good morning.
Yes, and together with Moses, we'll take the next few minutes to discuss this signs, symptoms, and the prevention of coronavirus. But maybe I should start from the lighter mood. I'm seeing you with hand gloves. I'm seeing you with nose covers and all of that. I don't know. Are you scared of coronavirus? We don't have it in Nigeria, so.
No.
Okay. Okay. No, it won't even.
No.
It will never come to us.
That is why we want to guide against it. Prevention is better than cure.
Okay.
Okay. Well, it's now called COVID-19. So we could say, well, coronavirus, we can still call it. But can you just enlighten us? What is it we don't know about this virus? Of course, no case has been recorded in Nigeria. And I also believe that Africa also by extension. But the WHO has declared it, emergency, because the way it's spreading over, this has killed more than 1,350, people in China. So how should we be worried, or how worrisome it is for us?
Yeah, thank you very much. Coronavirus pandemic has now prevalence in about 26 countries of the world now, including China. Despite the sophistication of China, when we talk about medicine, India, also US as well, they still have a large number of people that have been affected and infected by this very deadly disease. A disease that has defied all medical solutions. There is no cure for it now, as at now. And that is why we have deemed it fit to come to create awareness and sensitize our people about this pandemic disease. China, for example, we are informed that about 60,000 people have been infected there, and out of these, about 1,380 have been confirmed there. And when you look at it, China people, the Chinese, they are very many in our country. And all over the world, you see them here and there. And most especially in Nigeria, you find out that most of our industries are dominated by these Chinese. That is why it is of paramount importance that we have to sensitize our people about this very deadly disease.
Okay. Now, let me come to Comrade Fashioner now. Yes, you still tell us other things about it. But Red Cross, like service provider they are, how, to what extent have you, as a body on your own, not only in Nigeria, across, have you also prepared your personnel to handle this? This a situation that is coming out for the first time. To what extent?
Thank you very much. If you say this is first time of it in Nigeria, you are just talking of coronavirus alone. Because when you are talking coronavirus, such thing that have we normally call it disaster disease, disaster period, because when it involves many people. Now, when we are talking of alert, and if you listen to news, our Secretary General, Abubakar Kende, in Abuja has said that Nigerian Red Cross has prepared about 1 million volunteers for this alertness of our people, not to have it being infected. Why are we talking of our people not being infected? It is when you know what to do, and what not to do, that you can make it to be prevented. As in Ogun State here, let me be sincere, we have 20 local governments, and we have all our members in all these local governments that we have got them prepared. We have just finished the training last week, the disaster management of cholera virus, that is if, which we are not praying for. And what are the preventive measures? You have seen us with this glove, with all this one, you get yourself prepared. This summertime period, you try to avoid sneaking in this dust. This animal, you know, many of our people are hunters. You have to prevent handling live animals as at now with bare hand. Even if you do not have these gloves, you can improvise. You can have your handkerchief, put it in your hand and use it to hold or to touch. This time around, today is a Valentine's Day, what do you call it? People will be hugging.
Don't spoil the fun for people. It's Valentine's Day.
People will be hugging here and there. At this period in time, you should be very, very cautious of whom we touch. You cannot know who has been infected. You cannot know. But it is better we prevent it.
Okay. So are you saying we should start using gloves, nose cover, or the face mask as part of preventive
It's part of the preventive. But let me be frank with you, you are traveling, you do not have it, you can improvise. This nylon, brain nylon, you can use it to cover your face. In order not to have it been infected. You know, the virus they are talking about is what naked eye could not see. Even people, they put it in a microscope, this or something like that, before they say they can see it. As at now, as what they are telling us, there is no yet cure
for it.
Yes.
We don't actually pray
We
for
don't,
it.
yes, actually.
Okay, Chairman, sir, your team in Ogun State, nobody is actually praying for any disaster, but we should always be proactive, all right? But this new effort that the Red Cross is making, and this advocacy, like Mr. Comrade Fashioner also said, the National Secretary, is it because, why this sudden surge by the Red Cross, you know, doing advocacy, moving around, sensitizing people? Why? Because in Nigeria, I want to believe that we are always ready.
Yes. In fact, if you listen to, I think, the Minister of Health, he said about 260 million naira has been earmarked to guide against this disease. In case it comes, we are prepared. From the Red Cross perspective, all the local governments, the 20 local governments that we have in the state, in Ogun State, we have all our volunteers ready, prepared, trained to handle this type of situation. In case
let me get something clear there. You said volunteers. Are you talking about members of Red Cross or other people who have volunteered to assist Red Cross in this?
Well, members of Nigerian Red Cross Society, Ogun State branch, we have the volunteers there in all the local governments that have been trained, and they are always prepared to swing into action anytime anything like this disaster happens. You see, we don't just have to wait until we record anything before we start the preventive measure. For example, we cook egg, we cook meat, and what have you. This time around, not just cooking raw egg and eating it. It has to be well cooked meat, well cooked before taking it. Because from all these pigs, rats, bush animals, pogs, and what have you, these are the area that human being can easily contact this deadly and incurable disease. And that is why we just have to guide against it in Nigeria. But in Ogun State, we are prepared. We are prepared to work with the Ministry of Health, the state government, at any time that we are called upon. We are prepared to work. We have the manpower to swing into action in case of this kind of a thing.
Okay,
we have to create the awareness.
Okay, Comrade Fashion, I know that currently we have 3 isolation centers in Nigeria, Lagos, Abuja, and Kano. And I mean, I went to an eatery yesterday, and before I entered, they had to check, my temperature. So we're looking at all these efforts. Are we really doing enough?
Thank you very much on that one, but as my own field is concerned, as the National Training Ambassador, just to put some other things in what you just said about how prepared are we in Ogun State here. That's a program that is now going on in the Red Cross, which we call community-based first aid. Our volunteer may not be able to be on the spot, but people on the spot are the people to render first aid first. So that one is going on. That is training the villagers, community members. Now the issue of isolation center here and there, that is checking your temperature, checking this one. These are part of the prevention. That is, if you notice anything within you that is very, very abnormal, you slept yesterday, fine, but this morning you are not feeling okay, why can't you just go to the hospital? And please avoid self-medication in case of any other thing. Avoid self-medication. You wake up in the morning, you are running nose, you are having your temperature is becoming high, feverish here and there. You don't need to wait for anybody to tell you that you have to go to hospital.
But these symptoms you have just given, very similar to what regularly occurring to many people in this, because of our tropical environment, feverish conditions. What other thing could possibly, because if somebody feels headache and they're running, the next thing you do is to go and take anti-malaria drugs. But in this one, what can we also notice?
Let me tell you, when you say you're having a headache, the headache is being persistent. It's supposed to have calmed down after using that your self-medicated drug. Still persistent. The second day, the third day, you have to check yourself. Yes, you don't need to wait. And you are running nose, you use all drugs being prescribed to you, and it's not being cured. You don't need to wait. You don't need to. People don't need to tell you that you are going to die. You just have to prevent it and just go to medical. These people, some people. Let me be frank. As you are saying, they are testing your temperature here and there. The drug that fits my body may not fit the other person. And that is why you have to go to hospital. Mr. A uses ABC fever tablet. May not be applicable to Mr. B. You see, that is why you are. When something is being persistent, just continuously being affecting you. You are talking of running nose. If you have running nose in the morning and by 12 o'clock, it goes. That's all right. But if it continues, any disease, any illness in your body that continues beyond the normal period or longer time, you just have to go. You see, when they are saying this coronavirus or something like that, it's in Nigeria here. That is my own belief. It is only when things happen that many people will be rushing here and there, something like that. In Nigeria here, we are really prepared for it. But since this one has not come to Nigeria, and that is why we want to have the alert, and that is why Red Cross have to come in, and that is part of our duty. And disaster management is part of the duty of the Red Cross. And when we are talking of cholera, we are talking of Ebola, we are talking of this, it's global disturbance.
The Lassa is also around.
Yes.
In some states.
The Lassa you are talking about, because you only mentioned coronavirus, but let us
That's our focus.
What is Red Cross doing? Of course, Lassa
you see,
fever.
the issue of the Red Cross, when we are talking of all these diseases, this thing, our own is to alert people, to train them how to prevent it. We are not doctors. We are not this one. It is the doctors, it's the people that can give you any medication or something like that. But our own duty is to prevent the disaster. That is for not coming. And if it comes, go to the hospital straight. No other thing. The issue of you have bread at home, you put it there. In the morning, you saw somebody has something has just eaten it. The best advice, throw it away.
Okay.
That's the best advice. Or you see any of your food being tampered with all these rats. Some people, if it is on medical or people that are professional, they will tell you this is type of rat that causes disease. Type of, what concern rat that have eaten it and gone? How do you start detecting? Rat is rat.
That is right.
That is rat.
All right. You say okay.
I think
let
the set it off from coronavirus.
let me now take this other aspect of preventive yes. You see, you said earlier on, you said the Red Cross has actually trained people and all of that. But when you look at, I recall in the days, years past, the Red Cross, Boy Scouts, Girl Scouts, all those voluntary organizations are very well grounded in schools where they start teaching them. Now, I don't know what your experience is in Ogun State as a state chairman. Do we still have this serious interest as we always have in those days in our schools now?
Well, thank you very much. In most of our schools, we have the units and detachment. We have closed detachment. We have open detachment. Even in churches, we have them. But in schools, to be precise, you see, the problems that we are getting in most of these schools is when you train the students June, July, August now, during the vacation. We normally have training period of 1 week to train the youth about first aid, train them on first aid. And most of them, 90% of them are always students in primary school, secondary school, and tertiary institution. But the problem that we normally face is anything that doesn't attract
Is it a problem or a challenge?
Yes. Well, challenges. Anything that doesn't attract money, you see people losing interest there. And they don't know that first aid, the Red Cross, is very, very important as an individual, in your family, in the community. The problem that I said we are having is that when you go to schools to train them, when you go to detachment to train them, the units to train them, you discover that after training, they know all these things. What they are expected to do, they know them. But they will lose interest when you tell them to buy a uniform, because many of them are very indigent, most especially those in rural areas. But in so many schools in urban centers, we have them there. But we have them in many of our schools in all the states, local governments in Ogun State. We have them. And even in churches, we have them.
Okay. Maybe let me quickly chip this in. What are the requirements for membership?
Requirement for membership, you just come there, you undergo training, most especially during August, September.
Anyone can join?
Anybody, irrespective of your color, irrespective of your age, irrespective of your religion. Because many people, they think because of this cross, and therefore it belongs to Christian. We have Red Cross, we have Red Crescent. And not only that, anybody, irrespective of your
Anyway,
age.
the reason why I asked that question, okay, maybe Comrade Fashioner will take this one. The reason why I asked that question is that in the course of this preparation for eventuality, talking about this coronavirus stuff, and you said you have trained most of these kind of things within the younger ones. It's so easy. They play together, they do so many things together, and if they don't have adequate knowledge about how to prevent it, well, we thank God that it won't come. We are thanking God because we know it won't come.
How to guide against it.
Yes, I know. So how much of this preventive education that we have in our, if we can't go to the level of primary, in our secondary schools?
Oh, thank you very much for this question. When you are talking of first aid in youth or first aid in schools, the first and the paramount one is hygiene.
It's supposed to be a subject.
It's
Okay,
a subject in their own discipline. But in the Red Cross, in the Red Cross, we teach them health. What do you do at home when you are eating? How do you sit when you are eating? Do not talk while eating. Do not put a banana this thing on the floor so that you don't split on it and have broken legs. And all these type of things, we teach them. And the issue of spitting, teach them. If you want to cough, have your handkerchief. Cough in it. If not, you are coughing with that one. If you have any disease, it will be spread. That is, you are spreading it to other people. It's already in our curriculum when we are training them. Not because of this coronavirus or something like that. It's already embedded in our syllabus.
Okay.
So talking of health, that is our own primary duty for the youth. And for the adult, we teach them, if this one happens, what do you do? We teach them, if knife cuts your hand, what do you do? How do you, yes, if there's any convulsion with any child, what do you do? If there's epilepsy, what do you do? Or something like that. It's not because of a coronavirus that we are saying we are alert. We have been at alert at any time. And that is the issue of the Red Cross.
Excuse me, sir. We have been shipping certain things. At secondary school level, you see, this first aid of a thing is expected to be put in the curriculum. It is expected to. I really share this school.
I think it's in physical and health education.
It is expected to be handled by professionals, most especially like Red Cross. I cherish the idea of this secondary school day waterman. Day waterman, they have it as a special subject in their school. So I wish other secondary schools as well will imbibe this. It will help a lot to train the younger one, the youth, the younger one, because there are certain things that you just have to do. The law of hygiene is there. You have to teach this younger one. You don't just go to the toilet and when you come, you wash your hand always.
All right. So as our take home now,
Yes, sir.
the preventive aspect of it, maybe you just come up again with what the people should guide against. Definitely, I want to believe that even this prevention here in coronavirus could also assist in Lassa, could also assist in other diseases. And so let's quickly take that so that we will allow you to go. Let's quickly take those steps. What should be done? as preventive measures. Just
Thank you very much. To guide against this pandemic deadly disease, you wash your hand thoroughly, not washing alone with just ordinary water, but with soap. You have to wash regularly and thoroughly too. And apart from that, you see, you drink water. Don't say because the weather is very cold and what have you. You have to drink water. Make sure you are not very much thirsty before you drink water. And not only that, when you see the animals that are infected, like the poultry, pigs, and what have you, if you discover that they are weak or you suspect of infection, don't go there and touch them with bare hand. And that is the essence of this glove. Because if you do that, it may definitely be transferred to you, the keeper, as well. And when you suspect anybody having persistent runny nose, diarrhea, headache, fever, pneumonia, you don't wait for anybody to tell you that something is wrong there. You have to make sure the health providers are informed immediately. And that is why Red Cross Society, when we discover such a thing, we guide against it. We quickly swing into action, and we do the needful.
All right. We want to pray that we don't even have this around us. We want to thank you for coming around to educate us. We have the chairman, Nigerian Red Cross Society, Ogun State chapter with us, Prince Joseph Keke Obalanlege. We thank you for coming on the program. We also thank the National Training Coordinator, Comrade Yinka Fashino. We also thank you for coming on the program.
Thank you.
And I want to say that to you viewer out there, you have heard those basic things you can do to prevent any kind of communicable disease. It's a general principle, so that it's not only the coronavirus you have had, you don't even have it, but prevention, they say, is better than cure. So we thank you once again. So we'll be taking our break, and when we come back, our next guest will be in the house. It's still Newdawn Friday edition. Don't go away.
Coronavirus is now in some countries with thousands of cases confirmed mostly from China. This Chinese virus, up till now, remains a hidden mystery to mankind. Preventing coronavirus influenza outbreak has become expedient to countries across the world. Wash your hands often with soap and water for at least 20 seconds or use alcohol-based sanitizer. Avoid close contact with people who are sick. When you cough or sneeze, use tissue to cover your mouth and throw the tissue in the trash can. Ensure your throat is kept moist always. Coronavirus is spread through coughing, sneezing,